A very good morning, good afternoon, and a good evening to you, my subscribers, my friends, my followers all over the world. I love you so much. It's your friend, Royal Mac. Today I'm bringing in another yet interesting topic that has been disturbing you. You thought about it, your brother, your mother told you about it. If you haven't subscribed, subscribe for the next topic still, because I'm still bringing new and better topics for you to understand your health. Today I want us to look about why drugs do not work for us sometimes, or why do drugs give us side effects. What do we do that make drugs not work for us? Today it's what I want us to talk about. And my first point as to why the drug may not work for you, my friend, is wrong diagnosis or wrong medicine. This will start with my friends, the clinicians, my fellow doctors, clinicians, nurses, pharmacists, wherever you are. You could be in a medical center, you could be in a hospital or a pharmacy, and you prescribe medicine to a wrong diagnosis. Or you give a right, you make a right diagnosis and give it wrong medicine. This medicine may not work for the patient. So if you are there, wherever you are, and you find the medicine is not working for you, go back to your doctor, ask the doctor what's happening. You gave me the medicine is not working. Sometimes this problem comes from the laboratory, most especially the results we get from laboratory. You may find that maybe the machine wasn't lubricated or what, and you find that the results that are coming out give the doctor a wrong results, and he ends up giving wrong medicine to a right diagnosis, or a right diagnosis giving it wrong medicine. Self-medication. In Africa, we have a problem of self-medication, whereby people, when you go to the hospital and you treat yourself for malaria, and they give you, for example, Coartem, or they give you any other, they may give you Diatep or any other medication. What you do next time you feel like you're getting some symptoms of malaria, before you know that maybe it is not even malaria, you've already taken the medicine. You find yourself, you're not changing. Yet this time around, maybe you could be having septicemia, okay, bacteria in blood. But for you, since it is giving you the same symptoms or signs that malaria gave you, you just take drugs for malaria. So this medicine won't work for you. Another one is wrong dose. Yes, sometimes this will also begin with fellow clinicians, doctors, nurses, and pharmacists, wherever you are. Like maybe you're supposed to give paracetamol to an adult 1 gram 3 times a day, and you find that you're giving an adult 500 milligrams 3 times a day. Headache may not go away, or pain may not go away if it was what you intended to treat, because you're giving a wrong dose to this patient. If it is an adult that's supposed to be 1 gram and you give 500 milligrams, it won't work for this patient. So let us look into the doses we give patients, and we find that the drugs will work for them. And then next to dose is dosage. This one will go to you, our clients, our patients. The dosage is the times you take the drug and the days. I tell you take 3 times a day for 5 days, or you take 2 times a day, maybe for 2 days, and you stop. This medicine will not work for you, and you remain complaining, the medicine is no longer working for me, the medicine is not working for me. But it's you causing this, because you're taking the medicine wrongly. You're not taking the dosage as it was prescribed to you by your doctor. Then times we take medicine. What do I mean? The doctor will tell you take the medicine in the night, you take it in the morning. They tell you take the medicine after food, you take it on an empty stomach. Some of you, it even gives you side effects. You get severe stomach cramps, severe vomiting, because you're taking this drug at a very wrong time. They tell you take Coartem with a fatty meal, you take it with water. You begin getting dizziness and headache. You say the drug is not working for me, it is giving me serious side effects. So my friend, my followers, my subscribers, next time listen to the directions given to you by your pharmacists or by your doctor. When they tell you take the medicine after food, do so. When they tell you take it in the morning, for example, SSRIs like fluoxetine, some of you have some mental problems, it is taken in the morning, or you begin taking it in the night, it gives you side effects or it doesn't work for you, and then you begin complaining to the health practitioners that the medicine they're giving you is not working, yet the problem is with you. Then the other point I would like also to talk about is expired drugs. So most of the times people who buy medicine in outlets, in outskirts of the cities, okay, always check on the expiry date of the drugs you're taking home. If you take a drug that is expired, it may either create toxicity to your body, or it will not work for you. So either way, that's why I say today we're going to look at why the drug may not work for you, or why it would give you side effects. Either you're taking this drug that is expired, if it doesn't give you toxicity, it will either not work for you or create problems with your liver. Remember, the number one function of the liver is drug intoxication. So any drug you take, it goes to the liver. So if you begin taking expired drugs, my friend, my follower, my subscriber, it won't work for you. Because remember, what we're talking about is what, number one is what we call pharmacokinetics. Pharmacokinetics is what your body does to the drug. If your body reacts poorly with the drug, you're going to begin getting sensitivity, skin reactions. And then pharmacodynamics is what the drug does to your body. All these ones I've been discussing may be interrupted if you take the drug that is expired, or if you take it in wrong times. Another point I would like to talk about is drug interaction. There are drugs that do not work together. Okay, there's in pharmacology is what we call synergy. There's what we call agonists and antagonists. There are drugs that typically do not work together, and if you take it to another drug, it won't work. In other words, it may even give you just severe side effects to your body, toxicity to mention but refuse. So always look at the drug interactions, especially the clinicians listening to me, the doctors, the nurses, and the pharmacists. Always look at the drugs that do not work together and do not give them to the patients. And you patients who do self-medications, please remember this, that sometimes you'll take a drug that will react to the other, either it gives you severe side effects and will not work for you, and you end up being bedridden for some time. And then the other problem is what do you take with the medicine they give you? We tell you take the medicine with water or juice, you take medicine with alcohol. Remember, alcohol is the number one killer of our liver, and you're swallowing it with a tablet that is going to go to your liver. So my friends, if they tell you take medicine with water or juice, why then use alcohol? Why use hot porridge? Why use milk? We've told you use water. So 90% of the medicines that we take them using normal water. But you find people are taking medicines using sodas, they take medicine using porridge, they take medicine using alcohol. The medicine may not work for you because its bioavailability will be affected. Bioavailability, we mean the proportion of the drug that goes into circulation to produce for you the desired effect of the drug that we are intending to work for you. Sometimes if you take it with alcohol, for example, a drug like codeine is a prodrug. When it goes into your body, it doesn't work as codeine. In other words, it does not work in its inactive state. It has to change into another drug. For example, it changes into morphine in the body so that it can take away the pain you have. You could be maybe having osteomyelitis, you're having severe pain, maybe you could be a cancer patient. When we give you codeine, it is turned into another drug. Therefore, if we begin taking this with other ingredients apart from water, maybe you take it with alcohol or soda, you're going to affect this bioavailability in the body. Okay, my other point I'd like to talk about is breaking down the drug composition. In Africa still, I would like to use where I come from because I've seen this happen. For example, a capsule of ampiclox or amoxil. You know, ampiclox is a combination of amoxil and cloxacillin. It's in 500 milligrams. So sometimes when the children are sick in Africa, mothers do what you call self-medication. You buy a capsule, you go home and break it. You don't know even this capsule is medicine. So when you break down this capsule, you are reducing the composition of this drug. In other words, you are also trying to disturb the dose of this drug. If it is 500 milligrams and you remove a capsule, you never know you've taken off almost 10 of it. So this drug will not work. So brothers and sisters, avoid breaking down the composition of these drugs. If it is a capsule, give it the way it is. Once you open the capsule and give only the powder, you're giving an underdose to the patient. Lastly, the point I would like to talk about to you, my brothers listening to me, and wherever you are, please, most of the times drugs do not work for us because we do not believe in the medicine that has been given to us. You don't believe in the person who has given you the medicine. You don't believe it will work for you. Believe me not, it will not work for you. Sometimes you fail to believe in the doctor who has prescribed for you, in the clinician, in the pharmacist who has prescribed for you this medicine. It won't work. Believe me not, Drugs also work with belief. If you believe in the doctor who has written for you the medicine, it will also still work for you. So I thank you so much for listening to me wherever you are in the world. Thank you for subscribing. If you haven't subscribed, my brother, my sister, my friend, you're doing a disservice to me and a disservice to you, because I told you I'll continue bringing you important information that will help you in whatever part of the world where you are. Otherwise, I love you. Have a good Friday and a happy Easter. Bye-bye.